In the meantime, please introduce yourself in the chat. Good morning, folks. We'll be getting started in just a minute. In the meantime, share with us your name, organization, and your favorite road trip song in the chat. Good morning, everybody. If you haven't had a chance yet, please introduce yourself in the chat with your name, organization, and your favorite road trip song. And we've seen everything from old school jazz, Eagles, to Taylor Swift as your favorite road trip songs. We're really to have everybody here join us today. My name is Ruben Cantu, and I'm with Prevention Institute. And we are really excited to have people join us for today's webinar, The Promise of Cost of Gun Violence Studies in California, Findings and Lessons from Santa Clara County's 2022 report. We have a great lineup of speakers that are going to be joining us today. Really excited to have so many folks join us today. Throughout the whole webinar, please add your questions to the Q&A function on Zoom. Since we're going to be shifting into webinar mode, chat is going to disappear, but we are going to have that Q&A function still available. So please add any of your questions that you might have there. So just really quickly going over the objectives of today's session. Our objectives today are, we're going to be talking about amplifying gun violence cost studies as a tool to advance solutions to gun violence, highlight the use of racial equity and system changes lenses used in Santa Clara's 2022 Cost of Gun Violence report, and to uplift the role of public health in gun violence prevention. The agenda today, so first up, we're going to be hearing from Santa Clara County folks on their cost of gun violence study. We're going to have time for Q&A throughout their presentation. Then we're going to hear from colleagues at Prevention Institute on leveraging a cost of gun violence study to advance community-driven solutions for community safety and racial justice. We're going to hear from our friends at Hope and Heal Fund on the promise of cost of gun violence studies for advancing equity and prevention, which are two very important parts of making sure we have safe communities. And again, we'll have some time for Q&A at the end. just really quickly introducing the folks that are going to be part of today's webinar. I am Ruben Ganzu with Prevention Institute, and along with Brian Malty, Executive Director of Hope and Heal Fund, we're going to be moderating today's conversation. And we're going to be joined by Rhonda McClinton Brown and Annie Wu from County of Santa Clara Public Health, my colleague Lisa Fujiu Parks with Prevention Institute, and Cuco Rodriguez with Hope and Heal Fund. And I'm going to stop sharing screen and make sure that I've covered everything I need to cover before we jump in. Really glad to see the number of participants we have. We've got about 159 folks joining us today from all across the state, folks representing public health departments, folks representing community organizations from all across the state. Really excited to see how many folks are joining us. Again, make sure when you ask your questions, use the Q&A function, which is down at the bottom of your Zoom screen. Chat will be turned off. We are going to, before we jump into the first presentation, we're going to do a quick poll to see to hear a little bit from the folks in the audience. And Mary, are we? Yep, there we go, launching the poll. So the question is, has your community or jurisdiction completed a cost of gun violence study? And so your options are on the screen there. Yes, you've completed one. Not yet, but you've started one. No, but you have plans in progress to conduct a cost of gun violence study. Or no, but there is some interest in exploring the idea. So take a few seconds, pick your selection there, and we'll be able to share back out with you all what you all selected before we jump into the first presentation. Okay. Hopefully folks have had a chance to select their answer, and we can close the poll. And so we actually have a handful of folks that have said that they've completed a cost of gun violence study. About 30% of those who participated in the poll. One person who said not yet, but they've started one. A few people who have plans, and the majority, 2/3 of you all, said that they have not, but there is interest in exploring the idea. So hopefully today's webinar will provide you all with a lot of great information to catalyze your thinking and to provide you with some of the background and some of the knowledge that would be helpful for going into this endeavor. And speaking of that, I'm going to introduce our first round of speakers from Santa Clara County, who are going to talk to us a bit about the cost of gun violence study that they implemented. First up, we're going to have Rhonda McClinton Brown, who's the Deputy Director of Strategy, Policy, and Planning for County of Santa Clara's Public Health Department, and Annie Wu, who is a health planning specialist with the County of Santa Clara Public Health Department. They're going to be going up first. Their presentation is going to be split up into two parts, and we're going to have an opportunity for some Q&A in between those two parts. So take it away, Rhonda and Annie.
Can everyone see the slides?
Not yet, Annie.
Oh, okay. Hold on. I'm
While
sorry.
she's working on the slides, I just want to thank Ruben and the Hope and Heal Fund and the Prevention Institute for collaborating with us on today's webinar. I want to start with a quote from Helen Keller that it says, "Alone we could do so little together. we can do, but together we can do so much. And I wanted to start with that because so much of the work of our County of Santa Clara Public Health Department is done in partnership. And so with that, I would like to talk about our cost of gun violence study and begin with an acknowledgement of the collaboration that it took to get us to this report that we're presenting today. I want to acknowledge Ted Miller and his team from the Pacific Institute of Research and Evaluation. I want to acknowledge Lisa Fuji Parks, who you're going to hear from today more from the Prevention Institute and her team. And then I would like to acknowledge our Public Health Department, a small and mighty team consisting of Annie Wu, who will be joining me in the presentation today, as well as our outstanding epidemiologist, Anandi Suhir and Mandeep Sindhu. We could not have done this report without the collaboration of all of these people. So I just wanted to start off with that. To talk a little bit about some background to ground us in the conversation, I just want to say locally, gun violence is among the top 10 leading causes of premature death among Santa Clara County residents. Gun violence is very complex and, as you will see, costly, and can fall among many domains, among many different axes. We have fatal and we have non-fatal. We have intentional, we have unintentional, we have self-inflicted. We have that is inflicted upon others. The most common forms of gun violence are accidental injuries, assault, homicide, and self-inflicted or suicide gun injuries. There are various forms and categories of gun violence, you can imagine that the strategies that are required to address these various forms as well as prevent them is very large and complex and requires quite a few different lenses and approaches to address it. You can go to the next slide, Annie. So it's really difficult to talk about gun violence without talking about the role of race and equity in gun violence. Nationwide, African ancestry individuals experience 3 times the greater fatal police shootings and 10 times greater gun homicides compared to white Americans. Similarly, Latinx populations are 1.5 times more likely to die by police shootings and 2 times more likely to die by gun homicides compared to white individuals. They are also increasingly being targeted for hate crimes. Here locally, African ancestry residents had 2 times higher firearms death rates compared to white residents. And the homicide firearm death rates were 8 times higher among African American residents and 3 times higher among Latinx residents compared to white population. Suicide firearm death rates were 2 times higher for white residents. The purpose of our cost of gun violence study was to quantify the economic and societal costs associated with gun violence in Santa Clara County from the years 2000 to the years 2021, and really has helped shape and inform policy options and strategies to advance gun violence prevention. The impact of gun violence is very large and vast, and it's very difficult to quantify the cost monetarily. The impact is beyond the individual that's impacted, but extends to families, communities, witnesses, and really crosses generations. This study, which was directed by the Board of Supervisors, provided the board and other decision makers with a public health approach to gun violence prevention and points towards more effective policies and investments for upstream and systematic violence prevention strategies. Our public health department collaborated with Ted Miller from the Pacific Institute of Research and Evaluation to apply a peer-reviewed framework for all the data domains utilized in the report. We utilized both direct and tangible costs that included healthcare systems and medical systems, criminal justice systems, and other public health systems. In addition to that, we also looked at indirect, intangible costs that includes elements such as loss of income and loss of quality of life, And stay on this slide just for a second more, Annie. And I also want to say, in addition to the direct and tangible costs, as well as the indirect and intangible costs associated with gun violence, we also used some contextual local data, such as gun sales. We obtained gun sales from the California Department of Justice to assess the volume of gun purchased by the county residents. We also used other data sources such as socio-demographic data to contextualize the county population composition. And we used US Census Bureau and American Community Survey information for that. We also looked at population surveys like behavioral risk factor surveys and the Children's Healthy Kids Survey to understand risk behaviors and lifestyles pertaining to gun ownership, storage, and use among adults and youth residing in the county. And then last, we used behavioral health services data, both as a component of the other public sector data, but also to summarize the services provided to county residents in the context of mass shootings. This study was initiated by the Board of Supervisors in 2019 following the Gilroy shootings. And the Public Health Department, due to the COVID pandemic, really wasn't able to start this study for quite some time during the pandemic, but the impetus of it was following the mass shooting. So we felt like behavioral health services data that was really utilized during the mass shooting would be an important factor to include in the study. And when Annie Wu gets to her part about some of the challenges, she could speak to some of the challenges that we experienced during the data. So I'm going to move to key findings. I want to spend a few minutes talking about who is most impacted by gun violence before I get into the cost of gun violence. You can go to the next slide, Annie. So one of the things that I want to talk about, which I don't have a slide here for, but I just want to provide it for contextual purposes, is gun sales. During the period of 2001 through the year 2021, the Santa Clara County experienced gun sale increased by 17% in the county. Statewide in 2020 was a record for the most handguns sold in a year since the start of the digital register keeping system in 1996. So following a trend of significantly increased purchases of gun violence in 2020, and in Santa Clara County in the same year of 2020, we saw an increase of gun sales to 31,794. And I say this because with the increase in gun possession, we have also seen a correspondence in the increase in fatal and non-fatal firearm injuries related to that and recorded in the county residents, as you can see on this slide. You can see on this slide the most significant increase in non-fatal firearm injury ED visits happened in 2019 and 2020, with 128 incident counts in 2019 and 156 counts of ED visits in 2020. This amounts to a 22% increase in non-fatal firearm injury visits in 1 year. You can go to the next slide. This slide really talks about race and the impact of non-firearm injury related ED visits by race and ethnicity. And if you can see on this chart, while we have various differences in populations between African ancestry and Latino populations in the county, African ancestry being about 2.5% of the county, the rates of non-fatal firearm injury related ED visits are very significant by race. So the age-adjusted rate of non-fatal firearm injury related emergency department visits was the highest among African ancestry populations at 34.1% per 100,000 people in the county, followed by Latino populations 12.4% per 100,000 populations. The next slide talks about death. And again, we see disparities by race related to death rates as well. The age-adjusted rate of firearm deaths was the highest among African and African ancestry populations, with 5.9 deaths per 100,000 people, followed by white at 3.0 and Latinx 2.4. And if you note, Latinx populations have higher ED rates than whites. However, whites have more death rates than Latinx, primarily due to the slide that I shared in the beginning, that white populations have the highest incidence of death by suicide. So now I'm going to shift to the cost data. As you can see, gun violence is very complex, and its impact is costly. In the US, firearm violence costs $280 billion in an average year. This amount includes lifetime costs associated with medical treatment, long-term physical and mental health care, lost wages, criminal justice costs, and quality of life estimates. From 2006 to 2020, the annual societal cost of firearm violence in Santa Clara County increased from $950 million to nearly $1.472 million. The average annual increase of $35 million equates to a 54% increase over a 50-year period. So we see the cost has significantly increased. When we look at the cost of firearm by the type of cost, clearly we see the quality of life indicators, 87% or 82% account for the largest share. During this period, the average costs related to non-fatal injuries and deaths were nearly $1.2 billion. And that includes both the direct and indirect, tangible and intangible costs that we talked about just briefly before. Medical looks like a very small percentage of the cost, but criminal justice is the largest percentage of direct costs associated with firearm violence. Then when we look at the intent, we can see that assault at 53% is the highest percentage of cost associated with firearm violence. During the 2016-2020 period, more than half of the firearm violence costs in the county were related to firearm assaults. Next slide. Costs for firearm violence to public sector. And so one of the primary charge that we received from the Board of Supervisors is really to understand the cost, the public sector cost of firearm violence in this Santa Clara County. And so we determined that the cost of firearm violence can be divided between private and public sectors. And during the 2016 to 2020 period, that we determined the average annual public sector cost was $72.5 million. The county level public sector cost represents sectors such as jail, parole, probation, medical, police, mental health, court associated costs, fire, EMC. So as you see, the criminal justice system really holds the lion's share of the cost associated with gun violence in Santa Clara County, the public sector costs. Now I'm just going to spend just a second talking about the city of San Jose. The city of San Jose did a parallel study also with Ted Miller and the Pacific Institute for Research and Evaluation. And we felt like it was important to pull San Jose data out because San Jose has the largest population in the county. But if you see per capita cost for firearm injuries, the per capita cost in the city of San Jose is almost half the cost of the entire cost for the county. And we felt like it was really important to pull that out and highlight it so that policymakers and decision makers could really think about investments and strategies for violence prevention in the areas of higher incidence of firearm violence in the city of San Jose, which you see on this map is showing as the darker blue areas. I just want to say, I'm going to close. I know that was a lot of data presented to you today, but I just thought I would take a pause before we move on to the next section.
Yeah. Oh, sorry. Go ahead, Ruben.
I was going to ask you to share any questions that have come up in the Q&A, Brian.
Yeah, sure. No, thank you, Ruben. Hello, everybody. Great to see you all, sort of. A couple questions here came in. One is maybe a pretty quick question, because I know we want to keep it all moving. How does one obtain copies of the study's data sets to conduct follow-up analyses? So that's one question from David. That I'll hand it over to you, Annie or Rhonda.
The study is posted on our public health department website, and people can receive a copy of it. Is it on the main website in our reports, Annie, or is it on our violence prevention website?
It's on our Santa Clara County Violence Prevention website, but it's also, I believe, in the email you received. The report is already in that email, but we can send it out after as well.
Great. I've kind of asked a couple other questions that just came in. I think they're pretty good. John asks, 82% of estimated firearm cost is quality of life. Can you define/provide detail on quality of life category?
I can do that a little bit. So there's a couple of tools used to assess quality of life indicators. There are 6 dimensions that are used in quality of life estimates, and those include mobility, cognitive, bending, grasping, lifting, pain, sensory, cosmetic aspects of functioning. And then there's a 7th dimension of impairment incorporated into a quality measure. There's also a Consumer Product Safety Commission, which is an acronym CPSC, also does quality of life estimates as well. So we used these existing published quality of life indicators to assess, to model what the quality of life indicator would be. And I'm happy to send, I think people can reach out to Annie Wu afterwards, and we can provide more information about the methodology used for the quality of life indicators. But it also includes loss of wages, those kinds of things.
Quick follow-up. Thank you for that. I know there are lots of good questions coming in, so Ruben and others, let me know if we might want to save these also to the end. But David, a follow-up from David, just to make sure we clarify. He was asking for not just the report, but the underlying data sets. I think there's some interest out there in the data sets as well.
Oh, yes. So some of the data is publicly available, and I'm not sure, actually. I need to ask that question about how available the data sets are publicly. So I would put that on the parking lot, and I will find the answer to that question. And then those that are interested in data, ping us later, and I'll let you know if we're able to release that data or not. I'm not actually sure about that. Some of the data that we used for the studies was readily publicly available data, but there were some data sets that had identifiable information to it, which we actually had to retain in the public health department and actually run the algorithms on behalf of Ted Miller and his team, because we were not given permission to release that data. So it, depending on which data source, reach out to us, and I'll find the answer whether or not we're able to release it or not.
Great. And I know, Ruben, you'll cut me off if we want to save some of these great questions, but I'm going to go to the next one, which is a great question. Did any of the results surprise the investigators? So Rhonda or Annie, do you want to jump in there?
I think what was more of we knew it was expensive. We knew that there was a large criminal justice component to it. I think I was a little bit surprised by the significance of the quality of life indicators, and how expensive that ends up being for gun violence that may not end in death, and how costly that is to us all. And then I think the other surprise for me, which Annie will talk about a little bit more, was the extreme difficulty it is to gather data across a 20-year period. And as you see with some of the data that we're presenting, we were not successful in all areas to go back 20 years because some data doesn't exist electronically going back, and even currently some of the data doesn't exist electronically. So for me, not so much the results, but there were surprises along the way in the process where we have many lessons learned from.
Ruben, should I keep going, or do you want to park?
Let's do maybe one more question, and then maybe we can hold some of these until after Annie finishes the presentation.
Sure. Ted Miller, author of the study, is on with us as well. And he is saying that neither the hospital nor the death data are publicly releasable, which also gets into a question is, how do you get around data sharing agreements between different agencies and HIPAA requirements for patient information?
So the second part of it is a question.
Yeah, sorry.
I'm sorry.
Yeah, sorry. First was Ted Miller is basically saying here that neither the hospital nor death data are publicly releasable. And that gets into the question is, how do you get around data sharing agreements between different agencies and HIPAA requirements for patient information?
Got it. Got it. Well, thank you so much, Ted. See, I said in the beginning, we can't do anything by ourselves. We need each other to get through everything, right? Data sharing is really a challenge and something that we continue to work on. And so sometimes we're very successful at it. And sometimes we find solutions that will allow us to do our work. In this case, as I mentioned, we had to keep some of the data within the county of Santa Clara. And Ted Miller and his team were so brilliant in creating algorithms and sending us the algorithms in which we ran the reports, and then they did the analysis of the summary data resulting from those calculation runs that we did internally here. And so each situation is unique. And with death data, there are risks of identifiable information, and so we just try to work through that. We have a wonderful county council in this county that works so closely with public health department. But we continue to figure out ways to work around data sharing challenges. And as you can see, that is, well, as you will see shortly, that is one of our ongoing recommendations, is around really continuing to hone in on this data piece, because it's an important piece for us to continue to do better so that we could have a better understanding of the magnitude of the problem and the impact of our collective efforts.
Great. Thank you all for fielding those questions, and Brian for bringing those up. And we'll go ahead and move on to the next part of the presentation from Santa Clara County Public Health. And we'll have more time for some questions at the end of that.
Okay, so we're going to move into the recommendations piece. But before that, I just wanted to talk a little bit about the framework that we used. The Public Health Department utilized a public health and socio-ecological model framework in our approach to the cost of gun violence study. And I just want to highlight why we thought this was important. And so in the public health framework, the define and monitor the problem, we use data to quantify the firearm violence prevalence in the county, but data was also incorporated in the recommendations to ensure an ongoing mechanism to monitor impact. The second phase, identify risk and protective factors. We know that institutional and systemic factors such as poverty, lack of economic and educational opportunities, racism and discrimination, unsafe neighborhood environment, and lack of support networks contribute to inequitable outcomes, especially for people of color. And firearm violence related racial and ethnic disproportionalities are highlighted in this report. Community stakeholders underscored the importance of protective factors such as social connectedness and community assets be included in the recommendations. And you'll hear a little bit more about that from both Annie Wu and Lisa Fuji Parks. Develop and evaluate prevention strategies. This report recommendations propose population level upstream strategies with an equity focus to help those impacted the most from firearms. And when we say upstream, we mean strategies that address the causes of inequitable factors leading to gun violence, or rather the whys, the why. And then lastly, implementing and ensuring adoption of effective strategies. This step ensures effective implementation and prevention strategies at multiple levels, from individual to neighborhood to community to countywide. In the Cost of Gun Violence report, we called out the need for cross-sector partnerships and the critical need for collaboration, partnerships, and coordination of efforts. And just really quickly, the socio-ecological framework just aids in the development and alignment of gun violence prevention strategies for maximum impact. This framework recognizes the deeply interconnectedness and the nature of complex social problems and how those social problems relate to gun violence. And it helps us identify the drivers and contributors to gun violence across multiple sectors of society. Annie Wu is going to talk a little bit, and Lisa Fuji Parks is going to talk a little bit more about our methodology and approach to stakeholder engagement that led to these recommendations. But I'm just going to highlight very quickly for you what our recommendations were in the report. Our charge from the Board of Supervisors was really to come back with an economic cost estimate of the public cost of gun violence. But we felt it was an opportunity for us to include in the report these recommendations as a call to action for the public, the community, and the Board of Supervisors to encourage investment and focus on a series of strategies that would really help us begin to address gun violence at our local level, utilizing a racial and health equity approach. So the recommendation, I think there are 6 or 7 recommendations. The first one is in the category of strengthen policy, advocacy, and public awareness. The first is encourage the adoption of gun safety policies and practices. We know that there's state legislation around gun safety, but there are many places within the County of San Jose, within the County of Santa Clara, to work with city jurisdictions to ensure gun safety for gun owners and the broader community, really making sure that gun safety laws are stored and their ammunition separate and they are locked. Recommendation 2 is using a racial health equity impact assessment tool to evaluate county policy positions on guns and advocate for more equitable prevention policies at the county and state level. We want to make sure that when gun policy are established, that there's not unintentional harm as a result of those policy recommendations. We also want to recommend and implement a public awareness and education campaigns, plural, on gun violence prevention. As we mentioned in the beginning, gun violence is complex and it's costly, and there are many strategies because there's many forms of gun violence. So we want to improve a broad public understanding of all of the different possibilities for gun violence prevention and really improve gun safety practices, broaden public understanding of gun safety laws, and support trauma-informed healing. The next set of strategies are all aimed to increase protective factors that advance equity. Adopting and replicating community-centered place-based approaches to gun violence in neighborhoods facing concentrated disadvantage and or concentration of risk factors for gun violence. Expanding partnerships with ethnic behavioral health service providers and community members to strengthen community-based crisis intervention, de-escalation, and mobile mental health crisis care. Improving policies and protocols to separate people in crisis from access to firearms and reduce the use of force during intervention. This strategy is really aimed at reducing criminal justice involved interventions and really improving capacity at a community level to address crisis that it happens either individually or with groups. Number 6 is to support excluded youth by increasing partnerships between cities, school districts, and the county to expand community-led social, recreational behavior, educational, and employment opportunities for youth. And last, 7 is really the piece around the data that I was talking about. We recognize that it's important for us to continue to strengthen government and community level coordination around data systems. And as a first step in that, we recommend establishing a gun safety data working group to guide us in the development of a data to action dashboard to really make sure we're honing in on where the data is and how are we sharing and collecting that data, both at a government level, but also at a community level, to allow us a better opportunity for data surveillance related to gun safety, but also to be able to measure our impact and to help drive and guide our action forward. With this, I'm going to turn it over to Annie, that's going to talk a little bit about where we are today with our implementation and what some of our strategies that have been for community engagement.
Yeah, thank you so much, Rhonda. Okay, so as Rhonda previously mentioned, after we presented our report and the recommendations to the board, this was back in August, the Board of Supervisors asked us to really prioritize, which recommendations we want to work on first and to develop some implementation strategies to really advance these recommendations at a community level. And so we were able to do more thinking and more conversations with our stakeholders. And we really kind of arrived at the understanding that all the recommendations we developed, it's not just for public health, but it is for everybody, for everyone who see themselves having a role in preventing violence, from government to community level stakeholders. However, in this space, public health has a unique and powerful role to play. And so we're really focused on what are some things that public health can do really well, right? And to advance this area of work. So strategy one is really around education, so violence prevention education, awareness building, and really changing the mindset around guns, around violence, around safety. So through our study, we really understood that when people acquire guns and use guns on themselves or each other, it's not just a behavior change, it's really about a deeper level culture change, right? There's a lot of current dominant cultural ideologies and narratives about what guns means to people. It ties to normative kind of ideas around masculinity, race, racism, classism, sexism. So really, we really see our role as educators to kind of provide an alternative narrative, to challenge those dominant narratives and provide an alternative narrative around healing, hope, and resilience. The second strategy is to understand and to really support city level gun safety initiatives. So in our county, I'm sure in many other counties, we really saw that cities having a huge role to play in both policy making as well as providing services and programs to marginalized youth and marginalized communities. And so this strategy is really about as county coming alongside the city partners and providing funding and capacity building to them. Strategy 3 is about investing in resident-centered and place-based strategies to increase protective factors. So this is really about understanding, that phrase, not about us, without us, really understanding that the people who are most affected by violence, who most have a stake in their communities, have to be the ones to lead and drive these solutions. And we as public health need to, again, support them with funding, capacity building, and to really emphasize on protective factors instead of looking at what's not working and only looking at the problem. And then lastly, strategy 4 is about enhancing community advocacy, civic mobilization to advance sound gun violence prevention policies. So this is something that came up through our stakeholder engagement. We really heard from our community partners, that there lacks a space for kind of non-law enforcement, non-criminal justice folks who perhaps they are community level advocates or resident leaders, community-based organizations, to really have a space for them to come together to talk about, to share resources, share ideas, to build collective action that's outside of the usual criminal justice strategies and tools. So I'm not going to go through this slide again. I think Rhonda has gone over it. So at this point, I do want to, in addition to the 4 strategies that we talked about, I wanted to talk a little bit more deeply about our strategy around data and addressing our data capacity. So this is just a refresher to say that, you know, in the study we went after a wide range of data, and we learned a lot from trying to access all of these data. So in terms of methodological challenges, what we learned was that, you know, data was really collected and owned by many different county departments and jurisdictions, which you know, resulted in a lot of different challenges and barriers. We learned that different data sharing, there were many different data sharing restrictions and different processes to collect data. There's no central data sharing agreement or platform. And there were also numerous institutional barriers. One of them is the data sharing agreements, which created a lot of labor-intensive and time-consuming processes for us to navigate. And then we also learned that many traditional data systems in the public health sector are really not designed to collect population level data that's required for these kinds of studies. A lot of maybe the EHR system or the system that's used in the mental health service sector really is designed to track the number of services provided rather than the number of people served. So that makes it very difficult when you're trying to look at the cost. You're trying to put the cost to individual units. And there are, so it also tracks services within the system, but not county-wide. So an example of our behavioral health providers going out into the community after a mass shooting to provide those services, those activities are not tracked or recorded in the system and cannot be counted. So in terms of what we want to do, our strategy in this area is really, we wanted to build a multi-sectoral partnership and using a collaborative approach, building public health data in capacity in infrastructure for system-wide surveillance, assessment, communication, and collaboration on gun violence prevention. So I think Rhonda already talked about this a little bit, but essentially what we want to do at this point, it's very early stage for us, but what we want to do is, number one, to find out what data is not being collected that needs to be collected, right, for better gun violence prevention work. And secondly, to find out what data is already collected, but collected maybe in a not so quality way. Maybe there are gaps or fragmentations or inaccuracies or issues with the way it's collected that needs to be improved. And 3, what data is already collected, analyzed, stored, but needs to be better shared with our partners, with people in the community to make them more useful for everybody. So lastly, so this is kind of all of our recommendations and implementation strategies that we shared. Again, I think Lisa will go into our stakeholder conversations, but here just to show that all of these things that we shared really were informed and driven and guided by extensive conversations we had in the community. And so I want to wrap up our presentation by just lastly sharing some resources and tools. There are so many out there, but these are just the 3 main ones. We looked at the racial equity impact assessment as a really great tool that's been used by a variety of different violence prevention practitioners. We highly encourage everyone to take a deeper look at this assessment and see if it's something that can be implemented in your work. We also looked at the community gun violence just sharing this website overall. It's a place for a great, lots of great resources. And finally, CalVIP Coalition. I just want to give a plug for these great people. It's really an open forum for anyone who's interested in community violence intervention. It's led by the Gifford Center, and you can email Brittany at the email there to sign up. And all these slides will be shared with all of you. And then finally, I know we share so much information. If you want to have a deeper conversation with us or have any more questions, please email me. My information is there. And again, you will get these in the slides. Thank you.
Thank you, Annie, and thank you, Rhonda. Brian, what are we seeing in the Q&A? It seems like we've had a lot of really great questions coming in.
It's burning up here. Yeah, there's a lot of great stuff. So been a lot around Rhonda and Annie about how the data is collected, specifically around domestic violence, police costs, and also, if I get this right, cost of civil lawsuits awarded and aftermath costs to families, children suffering trauma. So we got DV, we got police, and civil lawsuits awarded. So folks are wondering, how did you go about collecting that data? So I'll turn it over to either of you to answer that one.
We did include, which was kind of in the other public sector data, data from Department of Justice related to victim relief, which also I think would include legal awards and those types of things. So that was included in the cost estimate under the other category.
Great. Maybe an easy question, but what is the cost of doing this kind of report? I think folks want to know. So I think it's a great question. I'll turn it back over to you guys to answer that.
Well, that's a really great question. So I think the public recorded cost of doing this work was the Board of Supervisors of the County of Santa Clara awarded or allocated to the Public Health Department about $215,000 to do this study over the course of time. And as I mentioned before, the study was granted and approved in January of 2020, and then guess what happened? And so we really didn't do much of anything for the first year because we were all of our epidemiology team was 100% assigned to COVID duty. And so it wasn't until we got to a place where they could dip out at moments of time that we could really start doing the work of this study. But we had a budget of $215,000 to do the study.
And question, what advice would you all have for other health departments or government agencies wanting to do this sort of study?
Yeah, I think, Annie could squeeze, don't do it during a pandemic. Don't do this study during a world pandemic. It was really hard. A lot of in-kind contributions from the staff to get this work done, a lot of start and stops because we also were doing COVID duty at the same time. So that made it difficult. I think that what would really, some of the lessons learned that we had is if we could have had the benefit of having a data working group on the front end and really had a little bit more time and flexibility to get our data game plan in place before we started, that probably would have made it a lot easier for us. We just didn't have the gift of time and the staffing resources to do that, but that probably would have made it a lot easier. I'm sure that Annie and our epidemiologist and Ted Miller might have some other lessons learned, but I think that piece would have been easier. There's just so many changes that happen in data systems over a 20-year period. It's very difficult to do a real accurate cost analysis over a period that long. So maybe also not have the cost analysis over such a large period of time when you have so many changes in data systems that really, build some factors in workarounds that are needed as a result of that.
Great, thank you. And great question from Dominique. She asked, have there been any collaborations around live person-to-person case review with law enforcement and or other partners?
We have not done that yet, but I think that's a really great idea. And I think that moving forward in some of our collaborations, that would be a really exciting thing to do.
Sorry
I
there.
think
Go ahead.
I was going to say, I think in the interest of time, maybe we should move forward and have Lisa start her presentation. She might be able to answer some of the questions that are coming up in the course of her remarks, and then we can get back to the questions. I saw somebody ask whether this is going to be sent out. We will be sending out the recording and the slides to folks that attended today or that registered, so you can rewatch. And we'll try to get to as many questions as we can today. We're getting a lot of questions from folks, really good questions too. So we'll try to get to as many of those as we can by the end of today. So now I'm going to introduce and hand it over to Lisa Fujia-Parks, who's an Associate Program Director at Prevention Institute and who is part of a lot of our projects on community safety. And she was a part of this project as well. Lisa, take it away.
Thanks, Ruben. And I'm going to start my 10-minute timer. Can everybody see me, see the slides okay? Great. So just so much gratitude to our partners at the health department. You've witnessed just a little bit of a taste of their brilliance and their strategic approach. And they really talked about the what of a cost of gun violence study, but they're always thinking about the so what and then what. You know, they were asked a particular task by the supervisors who were interested in at analyzing this problem, and they knew that it was important to really leverage this pretty heavy lift of a study to really advance solutions that were community driven and grounded in racial justice. So that's what I'm going to talk about. I'm going to keep the shout outs coming. As you can hear, there's so much of a spirit of collaboration and being in this together as a movement. I want to shout out my colleagues who were part of the project team, as well as other colleagues who were part of the tools, development of the tools and resources that informed our work on the study. So I'm going to talk about leveraging the cost of gun violence study to elevate gun violence as a preventable public health issue, to really lift up the strategic importance of community engagement and community-centered narratives, and share a few more Prevention Institute resources. So Annie mentioned that before the community listening sessions, when Prevention Institute was brought in, we decided to ask our colleagues who had conducted cost of studies for advice about how they had used their studies, what recommendations and advice they would give. So deep gratitude to the organizations listed there who were generous in sharing their experience and insights. And also, you know, we reviewed 20 studies and other documents to really look at what others had done and learn from that. And the result of that was a memo that we wrote to the health department, giving some guidance, some recommendations on how to go about this process in a way that would really elevate community-driven solutions centered in racial justice. So I'm going to share those pieces of guidance that we offered. And as you're listening, I'm going to ask you to think about which piece of guidance resonates the most for you and why. And then we're going to have another poll to hear what you think. So the first one is to just, again, confirm that the study is an opportunity to elevate gun violence as a preventable public health issue, to really keep that frame in mind throughout all of the steps of the work. The second piece of guidance is to lift up community leadership and voice in the study and in all gun violence prevention efforts. As Annie mentioned, the people who are closest to the problem have a deep understanding of the problem, its impacts and insights into the solutions, and their leadership and voice is absolutely essential to any discussion. Thirdly, to really take a commitment to communicating the study findings in multiple formats for different audiences and purposes. No one wants a giant study on a shelf. These data points need to be shared in different formats with a commitment to doing that on an ongoing basis to make use of this tremendous investment. To build program policy and budget recommendations on existing assets and efforts. There exists a vibrant and robust ecosystem of community members, organizations, leaders who are all working on this problem, and there are solutions that are ripe and ready for expansion and evolution. So to really deeply be connected to those efforts that are ready to go and ready to be invested in at a greater level. And lastly, to focus on actionable solutions that can lower the costs of gun violence in a way that centers equity and reduces the kinds of frictions that can stymie progress. Anytime we're talking about costs, resources, public resources, where they're being invested, where they should be being invested, where we want to save resources, these are going to be some tough conversations. So anticipate some conflict, some tensions, and come with a spirit of actionable solutions. We are all wanting to solve these issues and to move forward with solutions that work. So really to bring that spirit. So with those insights in mind, the study proceeded. Annie mentioned that we conducted these community engagement listening sessions. They were critical to asking those questions about what people were concerned about, what they were seeing, what they thought the root causes of those issues were, and what were the solutions that they wanted to see invested in, and where were their existing assets to build in. So again, here are some examples of the groups that we spoke with. We generated a lot of insights, a lot of ideas, a lot of creativity, and then we had to prioritize. And so there were lots of strong themes and repeated ideas that came out of that process. And we used a set of criteria to vet them and prioritize them. So these are the 7 criteria that we used. Does the solution address root contributors to gun violence? Does it advance racial equity and avoid unintended harm? That racial equity impact assessment that we conducted on all of the ideas, all of the recommendations. Does it address a priority articulated by a stakeholder group? We're not going to ask you what's important and then ignore that. We're going to really try to find solutions that move forward those priorities. Does it have a high level of support among stakeholders who participated in the sessions? You know, because the community, the folks, the partners are the ones who are going to implement these ideas, right? So we want to really look for that engagement and readiness to move forward. Is there a high level of effectiveness, of evidence of effectiveness in the research and practice space? And there was a question that came up from one of our participants around proof points. And yes, all of these recommendations were vetted through the existing research and practice evidence base. Does it build on existing assets, investments, and partnerships in the county? And does it fill a significant gap or need? There are several related efforts happening in the city of San Jose and in the county of Santa Clara. So making sure that efforts and the recommendations are either complementing and strengthening those recommendations or filling a gap, but not working at cross purposes or duplicating existing efforts. The county health department was really committed to, as I said, elevating community voice. Now, all of this are not necessarily typical parts of a cost of gun violence study. It is not necessary. It is not a standard practice to include quotes from community members in your report. But boy, is it powerful and important. So the report you will see includes direct quotes from community members speaking to the solutions that they wanted to see move forward. And powerfully, when the health department presented to the supervisors, there was real interest in knowing, okay, which group was behind this recommendation? You know, my constituents in my part of the county, what did they say, right? So we have to understand that moving forward solutions really is about elevating, the voices of the people who are engaged in this work. So there's another opportunity to do that through the inclusion of quotes from your community members. Community-centered language and visuals that reinforce racial equity. So we combed the report for racially biased language, As we all know, racism and other biases can get baked into our language. Annie talked about shifting narratives. We have to really, really be vigilant that we are not reinforcing biased ways of understanding the problem or biased solutions. And so even with such a deep commitment to approaching this work in a racially equitable way, we were like, okay, we need to comb the language and make modifications. And this included making sure that people of color and communities of color were represented as leaders and agents of change and solutions, avoiding racist stereotypes and imagery, and showing community-centered images that show community in context rather than police cars and violent imagery, balancing the visualization of the mourning and the trauma with also hopeful images and protective factors. And of course, the health department was completely aligned with this approach and was able to accomplish this even with the limitations of stock photos. So just really want to encourage folks as they think about proceeding with their cost of gun violence studies, again, to elevate community-centered solutions, community voice, and leadership in racial justice as they go about doing the work. Here are some additional resources from Prevention Institute, policy recommendations, ways of bridging health equity and racial justice, examples of other community safety plans and policy efforts we've been involved with. And we have worked with at least 25 locales, either directly as a co-facilitator of community safety planning processes or development of studies and policy recommendations in many different counties and locales throughout the country. So examples there as well. And thank you all so much again for the opportunity to be a part of this effort, and just so happy that the recommendations have been adopted by the supervisors and are being implemented. Thank you so much.
Thanks, Lisa. Thanks, Lisa. And I think we're going to launch another quick poll for folks to really quickly answer. So this poll is around which piece of the guidance resonates the most for you. And we've got a list of 6 items there, one of those being all of the above. Go ahead and take a second to respond to that. In the meantime, I'm going to let people know we are getting so many questions, so many amazing questions, really, really thoughtful questions in the Q&A section. There is no way we're going to be able to get to all of those questions. So we are saving those questions, and we're going to respond to those questions with some written answers that we will get out to folks who are participating today. We want to make sure that we kind of get to all of that. So along with the slides and the recording and the links that we've talked about today, you'll be getting some written responses to questions. So if we don't get to yours, we will get to it in one way or another. We also just, as we said earlier, wanted to recognize that Rhonda had to leave us early today to actually go out and defend the investments into gun violence prevention for the county. So we'll be tapping into her when we try to respond to those questions in writing. So let's go ahead and close that poll and see what our responses show. Yeah, it's a pretty good mix of folks. All of the guidance, all pieces of the guidance seem to resonate with folks. With most people saying the majority of, not the majority, the largest chunk of folks saying that all of them actually resonate. So thank you all for participating in that quick poll. We're going to move on to our last speaker of the day today. So I'm going to ask Cuco Rodriguez, who is Chief Equity and Program Officer with the Hope and Heal Fund, to step forward and talk to us a little bit about the promise of these studies for specifically advancing equity and prevention. Cuco, take it away.
Thank you, Ruben. Thank you, everybody. Can you hear me? Ruben?
We can hear you.
Okay, good. So welcome everybody. Try to be brief and see if we can get to some questions. I guess at the end. Well, first off, welcome. I'm Cuco Rodriguez. I'm with Hope and Heal, the Hope and Heal Fund. We're a statewide fund focused on comprehensive violence prevention, while centering our work on the intersection of gun violence reduction, race equity, and systems change. I think as such, we don't do policy work, this is kind of those strategies that we really want to support. I think for far too long, we viewed gun violence as a law enforcement issue, and as a consequence have put forth solutions that emanate from that lens. And certainly, I don't want to criticize, but we should be honest that law enforcement is working way out of their scope and area of expertise when it comes to prevention. Moreover, I think that this fact has made it difficult for us to view gun violence as a preventable issue that requires a differential response that does not originate from the law enforcement field. The fact is that this is a public health issue, and the expertise that exists in prevention is situated in other fields, not in criminal justice. And again, it's important to remember that the scope of law enforcement is intervention and not prevention. And I really need to state that there are also some serious issues of trust that exist between law enforcement and BIPOC communities that we should also consider when employing strategies in different communities. For us, this type of analysis, we hope, also begins to open up other opportunities to explore alternatives that are more in alignment with the needs of communities, while also looking at long-term success and cost savings. We're also hopeful that it opens up opportunities to explore the development of assessments and frameworks that categorize interventions and investments in terms of prevention, intervention, and aftercare work as it relates to gun violence. To be clear, I think that what we often find when we do this is that in most of our investments tend to be in the law enforcement strategy that are centered in response and not in prevention or trauma-informed aftercare for victims. For Hope and Heal, in terms of our equity and systems analysis and change work, it raises some important patterns and areas for more work. We utilize cost-benefit analysis for multiple decisions made at counties and municipal levels. While some may criticize the cost study and may debate the metrics used, we should be clear that we need to really explore further cost-benefit analysis for communities of color and the impact of gun violence on other areas of the economy. For example, we need to assess the impact on our economy in terms of housing valuation and the impact of business sectors. This report, I think, also makes it clear that we are spending a significant amount of money to investigate loss of life. And so it would also make sense that we should also develop more strategies that account for the emotional and economic impact of that as well. We should also use this as a pattern in terms of, or as a template that would allow us to assess how often these investigations lead to prosecution and the cost of prosecution, how much we're spending on tracking the origin of weapons, and how much we're spending on investigating and prosecuting the trafficking of weapons that are coming into our communities. Again, these are all areas of opportunities where we can develop cost-benefit analysis similar to this. So while some folks may criticize, again, the process or what we're debating about what was used and what's accounted for, the fact is that we need to do further cost-benefit analysis on the impact that some of these things are having on our communities that we're not assessing, that are very expensive and are costing us a great deal in terms of loss of life, but also economic costs. From our standpoint, as Hope and Heal, again, emphasis on the heal. We hope this report also highlights the importance of identifying approaches that address root causes. So while we feel that we should find out why young people and others have easy access to weapons and where these weapons are coming from, I think this report truly should lift up that existing strategies that are rooted in criminal justice are not preventing, and it should also not doing prevention, and it should also highlight that gun violence is a symptom of a larger and deeper issue. I really cannot emphasize this enough. While we believe that access to firearms is a serious issue, there is an underlying issue that human services and public health must address. And that is that there exists an underlying view for those impacted by gun violence, that we should solve an issue of an issue or conflict by taking our own life or taking the life of others. And I hope that we all agree that this certainly is not something that we would ask law enforcement to address. In my personal experience, as well as professional experience, this has a lot to do with trauma. In Santa Clara County, you're actually very fortunate to have the National Compadres Network, which is based there and has been doing a lot of the healing trauma work for well over 30 years. And I think that we should look in those directions and those organizations that are addressing a lot of these underlying root causes to violence, and specifically gun violence when there is access. I will stop there and hand it back over to Ruben to see if there are any questions. Again, I try to go very fast, but see if there's anything people want to add or challenge me on. That's fine too.
Thanks so much, Coco, for bringing up those important points. Great job in being concise and helping us get back on track here. Brian, I'm going to turn it over to you and see if we have any other burning questions that we want to try to address in the next 10 minutes or so.
Sure. Lots of burning questions, Ruben. Thank you all. Again, as Ruben said, it's just phenomenal. It's a kind of sensory overload, how many questions we have. And like we said, we'll make sure we get back to you. So it's really, really great. So question from Mark. You can direct this anywhere you want, Ruben, or anyone can jump in. How do you convince the community, everyone in the community, that gun violence prevention is something that they should support at a realistic and effective level, that it is something that will benefit everyone?
Can I jump in really quick? Again, as I said, this is, to me, the cost of gun violence report is really a cost benefit analysis that we haven't looked at. And I think that there's a lot of other areas of cost benefit analysis that when people start looking at how much we're spending and how ineffective we are, I mean, let me be really honest. We spend a lot of money on investigation when somebody, there's a homicide, a lot of communities spend a lot of money on investigating a homicide only to not solve it, especially if they're Black and brown. So I would suggest that most communities that are impacted by gun violence, and we did an analysis on the cost of loss of life, the cost of economic impact, all these other different types of cost benefit analysis, I think the community begins to see that maybe we're not investing in the best things. We're not investing in the most effective long-term things. What we've been investing in is the same thing, and it hasn't really benefited us and given us, and really, again, the absence of analysis, if the analysis comes back and says it's effective, then great, let's keep doing that. But if the analysis comes back and says it's ineffective, why would we continue to invest in that? Especially when we know that there are significant issues in terms of the impact that some of these interventions are having the opposite effect on communities than resolving issues. They're creating more problems.
Yeah, and I just want to quickly add to that. For us, as public health, it was surprising for us to learn that it's not just people who are, victims or impacted by gun violence who want less gun violence. In fact, a lot of gun owners want to see an end to gun violence. They don't buy guns in order with the primary intention of hurting themselves or others. But everyone understand that does happen, and as well as gun shop owners and just other people that you wouldn't think of as allies, right? They are in fact allies if we do reach out to them. I think for us, our strategy has always been, we're not saying take away all guns, like that's not our agenda, but we are saying let's use guns safely, let's keep people safe. And I think that's something that a lot of people can come around to.
Lisa?
Yeah, I'll jump in on this too. And just another shout out to the County of Santa Clara Health Department, where I have seen the health department over many years, and I understand many decades, partnering with community, partnering with various stakeholders, other government departments in community problem solving, regardless of what the issue is, right? The health department works on a range of different issues collaboratively, always studying what problems are emerging, identifying actionable solutions, implementing them in partnership, and then seeing results and building up that trust. And just doing that over many, many years, there grows a culture of collaboration and solutions finding and action. What was I going to say? Another thing that really impresses me about the county is the number of community members who become government civil servants, whether it's the health department or the rec department or you name it department. There are people who are from the county, from San Jose, gone to school in San Jose, who then become civil servants, and that type of leadership by and for the community that says, you know, we are here for our folks. We are here for cultivating a safe, healthy, vibrant, thriving community. It shows in the ability to mobilize together and to be effective in implementing solutions that work.
So
Thank you
Ruben,
all.
oh, sorry, go ahead, Ruben.
Yeah, go ahead, Brian. I think we've got time for a couple more questions.
Sure. So Eileen asks, first of all, thank you for the need for data to guide action. Her question is, how did you engage partners to share the data? That I think that's great because we talked a lot about the report. Now it's how do you connect and share this information with the community?
I can take a stab at it. Definitely, I would defer to Rhonda. So that's something that we can definitely share more information on after the session. You know, this is, for example, this is one way that we have utilized to share the information more broadly at a state level. So, you know, in the stakeholder engagement, we spoke to, I think I want to say over 140 people. We had like 40 to 50 different, around 40 different sessions. So I have an email list, which I email folks on, and we share this report. Our board has also directed us to translate this entire report into Spanish. So that translation work is happening. And so once that's done, it will be on our website. I think it's just through a variety of different methods, word of mouth, webinars, you know, emails, just getting the word out there and getting the data out there.
Great. And maybe we have time for one more question. I kind of like this question, kind of gets to why you do the report, why you engage the community, which is, can you give examples of types of recommendations, thinking about policy changes that can be made at the local level?
Okay, I'll take another stab at this. So at the local, so I'm just speaking for Santa Clara County. So at each county it may be different, but for Santa Clara County, we have a Healthy Cities program that's already established. That is really about the county partnering with city to kind of encourage, right? Like we don't have the power to legislate or to, you know, enforce anything, but we encourage and influence and promote healthy public health policies at the city level. And we award them with, you know, like a gold, silver, bronze, like those kind of a recognition, right? So we utilize that system to kind of promote, first of all, for cities to adopt safe storage policies, right? At this very, very evidence-based to reduce gun harm. And if they already have safe storage policies, we want to promote, encourage them to adopt like more like stronger safe storage policies. And there's a variety of things that can be added on. We want to encourage wider adoption promotion of the GVRO, lawful gun violence restraining orders. And there's other policies that you can influence around like racial health equity, having like adopting, for example, a racial health equity assessment in all your policies and legislation. Those are some kind of top of mind policies that can be done at a local level. I also want to point out, so please take a look at the city of San Jose. I believe they are the first in the nation in implementing kind of a gun liability insurance program. So that's something that's driven by, City of San Jose, as an example.
Thanks, Annie. I think we have time for one more quick question, and then we'll do a little bit of wrap up.
Sure. This is kind of a longer question, but might hopefully be a shorter answer. The per capita costs that showed the involuntary cost sharing, a tax on gun violence harm is borne by all residents. What components of the cost represent those that could be considered out of pocket, that is, expenses that are levied on taxpayers and consumers? That's something somebody wants to tackle, or we want to do a written response?
The example I give people is that I think we need to shift how we're viewing this, just in general, on both sides of this equation, people that are for guns and people that are against guns. And what I say is, when you're driving through your neighborhood and there's a house for sale around your neighborhood, one of the things that some people do, I'm not saying everybody here, but some people do, go home and what you do is you look it up, right? You go to I forgot the website. Zillow. You go to Zillow and you hope that house is selling at a really high price, because that means that your house too will increase in value, right? What you don't hope is that they sell at a very poor price. You don't do that, because that affects you. You're part of that ecosystem in that neighborhood. And I think that in like manner, when we look at gun violence, as long as it's not in our community and we're not it's not affecting, it's not in my neighborhood, it's cool. And to me, that's the equivalent of saying, you know what, if that property value drops, then I'm good with that. You're not. You shouldn't be. It's part of the same ecosystem, and gun violence touches everybody. And I think we're beginning to see that. And I think that there's an incurred cost for a lot of other things that we're paying for as taxpayers, in terms of law enforcement, in terms of everything. There's a lot. So to identify just this particular piece and saying, how much am I paying for it? I think that there's our tax dollars are going to other things that we should be more concerned about. Lastly, what I'll say is most counties and most municipalities spend more money on shelters for animals and the well-being and care of animals than they do for this particular issue and loss of life for human beings, particularly those that are Black and brown. So I want to say that because our tax dollars are going to a lot of things. I think that we need to start looking at this as an ecosystem where it doesn't matter where it's occurring, it is impacting our community, and we're paying a large price for it, not only in terms of our tax base, but also in terms of the impact and trauma that it's having on our community.
Thanks, Guko. I think that's a really great place to kind of wrap us up. I'm going to turn to Annie and Lisa also and see if you all have a quick, closing thought that you want to share with our participants today before we wrap up.
All I'll say is we all play a role in violence prevention. So that's our motto, that's our slogan for our county, and that's the message I want to share with the world.
Thanks, Annie. Lisa?
In the interest of wrapping up, I'll keep it brief and just to say, I know this is a really hard issue to work on. Take care of yourself, look to your colleagues, remember that we're part of a larger movement, and keep up the good work, and don't hesitate to reach out.
Great, thank you, Lisa. I just want to wrap up by making sure, we've gotten a lot of really great information from folks today. One of the most important things I think we need to take away from this is that this, by necessity, needs to be community-centered and equity-centered work. There is a role for everybody to play, from community organizations and advocates to public health. And we need to kind of come together to show the kind of support we need for these kinds of studies that really show the need for the kinds of prevention that we need to see happen in our communities, and really shift from thinking about gun violence and gun violence prevention as kind of this purely criminal justice focused movement,
to one that really needs to involve community, equity, and public health. So folks, we will be sending you all links to the recording and the report and other resources mentioned and the slides, and we will get to answering a lot of the questions that went unanswered today. Thank you all for engaging in such a lively discussion. And you will be hearing from us very, very soon. Thank you all so much for participating today. We couldn't have done it without you all.
Thanks, everyone.
Thank you. Bye.